Kathy Melton, one of our infoline nurses, and we're talking about orthostatic hypertension or postural hypertension. So I'll hand over to Kathy now. Kathy will talk for a bit, and if you have questions afterwards, put up your hand and I'll come to you one by one. Thanks.
Good morning, everyone. Thanks for having me on your Zoom meeting. We're talking about orthostatic or postural hypotension today. So blood pressure is the measure of how forcefully your heart is pumping blood around your body. Postural hypertension is a large drop in that blood pressure when you're standing or changing position. It can be a symptom of Parkinson's, and it can also be involved with the levodopa medication. Blood pressure naturally fluctuates during the day. It elevates if you're stressed and if you're physically active, and decreases when you rest or you're relaxing. So there's sensors in your carotid artery that reports your blood pressure to your brain, and that's part of the autonomic nervous system. And the reason why you get the fluctuations in your blood pressure, particularly with Parkinson's, is because that autonomic nervous system is affected by the Parkinson's, where everything slows down. The autonomic nervous system, that's not under your conscious thought processes, so you can't, really control that yourself. The brain, the nerves and the spinal cord make up the autonomic nervous system. The brain monitors and manages your blood pressure and adjusts it by sending messages to the heart and the blood vessels to make those adjustments required to keep the blood going, flowing around in that circular motion. So you've got a limit to your blood supply, so there's so many milliliters in your body, and it requires management by the autonomic nervous system so that more needs to go to different parts of your body. So it doesn't all need to be in your hands, it's pushed up to your brain when you need to be moving around. Yes. Certain activities require more blood in certain parts of the body. The blood pressure goes up when you exercise so that the muscles get more oxygen. And again, after a meal, more blood goes to your the gut area to digest the food. That's why we often say if you eat smaller meals, it has less of an impact on your blood pressure. The blood is diverted to other parts of your body and your blood pressure is reduced. The body senses when you stand up, and it tries to compensate by that. It stops the blood from pooling in your legs and pushes it up to the brain, so that you don't have that dizziness. If the blood pools in the legs, then less blood's returned to the heart, and then of course less to the brain. This causes that feeling of faintness or dizziness you can often get. Postural hypertension can be problematic with people with Parkinson's because of the slowness of the muscle reaction. So although the messages are slower getting down to those little tiny muscles in the blood vessels that contract and push the blood up to your head. Symptoms of postural hypertension are feeling dizzy or lightheaded. You can get blurred vision. You can get a feeling of weakness, fuzzy or confusion, headache, feeling faint, trembling, nausea, cold hands and feet, and sometimes even some chest pain. The causes of postural hypertension can be because of the Parkinson's, because of that autonomic nervous system. The medications can also cause postural hypertension. Now, when you're just sitting and you go to the doctor, you're sitting, and then he takes your blood pressure, what he should then do is to get you to stand up, and then after a minute or two, take your blood pressure again to check for that drop in blood pressure if you're getting those other symptoms. Because just taking your blood pressure while you're sitting there isn't going to give him a full picture of if you're actually getting that postural hypotension. As it drops down, the message is you stand up, and if things aren't pushing up fast enough, the blood's not being pushed up to your head fast enough, you get that blood pressure drop and that dizzy, fainting feeling. Now, ways of managing hypotension, postural hypotension: don't sit or stand for long periods of time. That's not good for anyone with Parkinson's because you get that stiffness going on as well. Avoid activity, a lot of activity in the heat, because then, you know, you start sweating and the blood is getting more to your skin and the periphery, so you don't have as much going up to the brain. You need to try and stay cool. It is harder for people with Parkinson's to regulate their temperature. Prior to getting up and moving around or getting out of bed, whatever you're doing, think about not just leaping up off the chair like you could when you were younger and before your diagnosis. You need to think about always move your toes, wiggle your ankles, you know, sort of squeeze your calf muscles, things like that, you know, just to promote that, that blood flow. Allow your feet to sort of, you know, sit on the edge of the bed. So gradually sit up, give yourself a few minutes, you know, wriggle your feet around and let your legs hang over the side of the bed so you can get that blood flowing. Stand up slowly, stand for a short time and monitor for how steady you are so you can't just like take off. Also, one big issue is dehydration, or that low, not having enough fluids on board. It's very tempting for people who are stiffer and slower to cut down their fluid intake, and it really has a big impact on that, on postural hypotension. So if you're feeling dizzy, you need to be thinking about getting some water into your system, and you know, you can still have some alcohol, but it has a dehydrating effect. So if you're going to have a glass of whatever alcohol, then you need to be thinking about making sure that you're having some water as well as that, or eating coffee and tea. They have dehydrating effect, so you need to be adding in some water. So if you're feeling a bit dizzy at the end of a meal, you know, blood's going to your gut to start breaking down that food. So have another glass of water at the end of a meal. That can help to maintain your blood pressure. Having the smaller meals does have less of an impact, so that's a good option as well. Avoiding vigorous exercise and getting really hot. So, you know, whilst exercise is very good for you, you need to be mindful of making sure that you're having the fluid intake as well as doing the exercise. Avoiding really hot food and drinks, because you can see with the hot food draws that more blood to the gut area, hence there's less to be going around because you have a finite amount of blood going around your system. So you know, if it's going to the gut, then it can't all be popping up to your head. If you're going to be, you know, you need to think about planning what you're doing, so that if you're going to be standing for periods, then make sure that you've got enough fluids on board, making sure that you know, wearing a hat, having some fluids on if you're going to be outside. So you don't stop doing those things and stop going outside in the heat, not the boiling hot, but medium heat. But you need to be thinking about how else you can protect yourself and maintain your fluid levels and that a good basic heat. Now, sometimes we do find that people having caffeine at night, it does have an impact on your blood pressure. But also sometimes people have a long history of high blood pressure before their diagnosis of Parkinson's, and oftentimes that's overlooked by the doctors and whatever, and they continue on those blood pressure lowering medications, which if you've got now Parkinson's, with Parkinson's drugs, then you can have that fluctuation in your blood pressure. So having a good medication review with all your pills, so that the doctor's got a good overall, it knows everything about what medications you're on, because then you get those drug interactions. If you and you don't want to be having postural hypotension where you're getting that drop in blood pressure and you're still taking your medications for high blood pressure. So that's, you know, most importantly really is don't be sitting and standing for long periods. Think about, make a plan about how you're going to exercise, and if you're going to be doing things outside, making sure you're having plenty of fluids on board, eating smaller meals. Don't be straining with your bowels. That's a bad effect with on the vagus nerve and can cause that drop in blood pressure. So good, making sure that you don't, that whatever you're doing, you're not constipated, that you're managing that well. All of those things together, as well as thinking about wriggling your feet around, squeezing your calves, and making sure that you risk manage that you don't fall, so that you've got something to steady yourself with, all of those things. Okay, so any questions?
I have a question.
Yes.
Sorry, I can't put up my hand because I'm dialing in.
No worries.
Cheryl from Ballina.
Yes.
My dad is on a medication called Florinef, which
Yes.
his doctor has given as, well, how he explains it is to help keep his blood pressure up as, and he has 1 in the winter and 2 in the summer.
Yeah.
So he always tells me to add extra salt to his food, which I find a bit weird because Dad only has 1 kidney, but it's to do with the Parkinson's medication. So that's one thing. And the other thing, I'll just give them to you both because I'm dialing in and you can get to them. My dad was quite unwell last February. He had a blocked bile duct and they thought we would lose him. And what was happening was that he was, actually, no, he got over that. He got another infection in his salivary gland because my dad's about 11 years into his Parkinson's and he's got quite bad dementia. And he was getting quite high temps with his blocked salivary duct. And what was happening was he would just be sitting in the chair, he'd go quite grey and he would actually like pass out, but he'd be in the chair, he'd be very sweaty and that. So obviously he was having a drop in his blood pressure. When I was checking his blood pressure, it was only actually sitting on about 60 on 35, which is pretty terrible. And yeah, well, you know, nearly dying terrible. And he was doing that twice a day. And when, because the doctors were coming to visit him at home, and they were saying that that was a Parkinson's disease reaction to the infection. So what they got me to do was to increase that Florinef. And but yeah, I just wanted to bring those 2 points up.
Yes, and people do have those low blood pressures. You can imagine how dizzy and faint you feel if your blood pressure's that low, very, very low. Yes, and there's no miracle drug. They do trial. There's a couple of medications, but it's not a miracle cure. And you know the doctors can put you on that, and you can try to see if that's going to help. If it is a very big issue. And it can help, but you need to be doing all the other things as well to try and maintain that blood pressure. Yes. So, how did they manage the salivary gland issue? They
just gave oral antibiotics and massage. Yeah, because my dad has an advanced.
Did he have a stone?
Sorry?
Did he have? Was it blocked with a stone?
The salivary glands? No, they weren't sure what that was. My dad has an advanced care directive, so he doesn't have very many investigations or treatments. He just has oral antibiotics.
Okay.
Yeah, but when he did have the blocked bile duct, it was just oral antibiotics, and basically we were preparing for him to die. But yeah, it would have been in hospital and with IV. But I just wanted to know like I know the doctor said that it was a reaction to his illness, was the way that his blood pressure dropped so badly with his salivary, like with the other infection that he had. Is that related to the temperature that they get, or it didn't seem to be, or is like, how does Parkinson's, like why was there such a dramatic drop in the blood pressure? Because he was just sitting in his lounge chair like every time. So
you know, when you've got an infection, like obviously really unwell, you know, the blood, everything's trying to fight is focused on trying to fight off that infection. So not enough, you know, circulating blood volume going around to keep the blood pressure up. So yes, everything's trying to fight that infection. Yes.
Yeah, so there's not really anything we can do
Well,
for
you
that.
need to be, as a priority, getting the infection under control and then maintaining him as he can be, all the other things, hydrated, all of those things, yes. Yeah. And yes.
Because he doesn't normally have a problem with his blood pressure. It's normally quite good. Okay,
yes.
thank you.
Okay, good, yeah.
I have a question.
Yes.
And this is Beatrice.
Yes,
my dad has Parkinson's,
mm-hmm.
and he has often, for a long time, also had high blood pressure.
Mm.
How he's on high blood pressure medication, and we've also had to change some of that because of the Parkinson's medications.
Mm-hmm. Yes.
I don't quite understand the effects of high blood pressure or low blood pressure. So trying to find the happy balance, is there one that's better to have than the other? I mean, for Parkinson's, he does have that, falls risk. So is it better to have the postural hypertension, or is it better to have high blood pressure? I know that's a really weird question, but it's just, how do I, because this is an interesting, one of the reasons that I joined this meeting was we've known about the postural hypertension, and neither his cardiologist nor his GP have ever said, oh, that's a Parkinson's thing.
They probably have never looked into it. Most of the postural hypotension is problematic because it fluctuates so much. The caller previously, her father's blood pressure getting down to 60 on 30 something, terribly low. That means you practically cannot function at all. So it's better off to have not too high, but higher, because then the fluctuations aren't going to have such an impact. Because if you're on, quite a low blood pressure and then it drops down, that's when you're going to really be at risk of nearly falling and hurting yourself, or being unable to do whatever it is you want to do.
Yes. So we find that as he sits in the evening,
Mm-hmm.
he gets fuzzier and fuzzier and whiter and whiter.
And is that sitting for a long time, Beatrice? Sitting?
Yes. And then if he stands up for about the next 10 minutes, he's white.
Yes, because his autonomic nervous system is rushing around trying to push the blood up to his head and get him moving again. It's that long periods of inactivity.
Yeah.
And so that the blood can sort of pull in the lower legs, and he stands up, and there's not the little muscles in the blood vessels are struggling to get moving, to push that blood up and around his.
All right. And can you just run through, you had this wonderful list of symptoms. And I got dizzy, lightheaded, blurred vision, fuzzy, cold hands and feet, nausea. There were a couple that I missed.
Yes, headache.
Headache, yeah.
You can feel trembly.
Yeah.
And sometimes people feel like an internally sort of bit trembly, and you can actually get some chest pain.
Okay. Thank you.
That's okay. Thanks for that.
Can I ask we have a new person just joined. Sorry, I admitted you late. Can I identify yourself? You've come in on the phone. Hello, can the person who just joined the meeting late identify themselves, please? You're on mute. Could you unmute yourself, please? Okay. Hopefully they'll be able to figure it out soon. Does anybody else have a question?
I'm muted now. Is that all right? Can you hear me?
Yes, we can. Who am I speaking to?
I'm Kevin Douglas.
Kevin?
Douglas.
Are you with the support group, Kevin?
Pardon?
Sorry,
What's that?
are you with us?
What did you, have I been there before? Yes, I have.
Do you go to a support group?
Oh, I can't catch what you're saying.
Never mind. Did you have a question about the topic for today, Kevin?
No, not yet. I'm just interested to see what's going on.
No worries.
Just taking
Thanks.
a step because there's an
Thanks for
info
joining.
below here.
Does anybody else have a question?
Yes, it's Nikki.
Hi, Nikki.
Hi. I've probably missed it. Sometimes the sound's a bit bad for me. But if the blood pressure suddenly does drop and you're not at home or whatever, I have had instances where a chemist, for example, has said you can't leave here until your blood pressure's got up again, and wouldn't let me go. What is the best thing to do?
To rest, to wriggle sit back down and have some more water, get some more water go into your system, and to, wait until that blood pressure starts to come back up again. So making sure that you're moving your feet and ankles, wriggling them around, squeezing those calf muscles to push that blood up to the head.
Water.
Okay, thank you.
Yeah. And good on the pharmacist for keeping you there. That's
Oh, he was very forceful. Yes.
good risk management, so you didn't fall over.
Yes.
Very good. Yeah.
I have a question.
Yes.
Gary's dizzy turns and low blood pressure occurs mainly just after he's had his breakfast of a morning.
Right.
Is there any reason why that would happen then?
Well,
And he's been told by his specialist to take a salt tablet.
yeah, and so the salt, increasing the salt then increases the fluids that you take in gets retained a bit more in the body with the salt. Okay, so that's why they do that, to try and keep your blood pressure up. So having an extra glass of water, it depends. You've probably been asleep in most of the night. Get up, have your breakfast, and then the blood goes to the gut, as we were speaking about before, to start breaking down the food products. So it's taking away from the rest of the body, because it's a limited amount of blood in your body. So only,
You want dusters?
and then it has to do the whole body. So if more's going to the gut, then there's less available to be going to the head, and hence you get that lightheadedness. So yeah.
Thank you.
The salt tablet, that's good, but you need to then have the water with that as well.
Thank you.
So before you get up from the table, have that extra glass of water, wriggle your feet around, whatever, and see if that can't improve things for you.
May I ask another question? It's Beatrice.
Yes.
In regards to eating, if the blood is rushing to the gut each time you eat, and you're saying have smaller meals,
Yes.
does that mean you need to limit how often you eat during the day? For instance, if my dad, has a snack and he has a couple of pickles or some grapes or something like that, is that going to have the same effect as a meal?
No, it's the bigger meals. It's, Australians tend to have, the 3 main meals a day.
Yeah.
So instead of having 3 main meals, like have, smaller meals, but more frequently. So you could eat more, have 5 times a day instead of 3. And certainly the but snacking is very good, because whilst you're keeping your calories up, you're not having a big meal of meat with 3 veg or whatever, and then a dessert. So if you can break it down and have 5 smaller meals instead of 3 bigger meals, then that is less impactful, because if you're eating, still the same amount of calories a day, but in, smaller portions and more frequently.
The body doesn't have to work so hard to break it down, is that?
Exactly, Beatrice, yes.
Thank you.
That's okay.
It's Cheryl here again.
Yes.
I'm just with our support group last month. We talked a lot about the importance of keeping a record of what was going on, so that you could take that to a doctor.
Yes.
So after this discussion, I would think it would be quite important for people, if they're having falls, to like document like how long after a meal it is, or what they were feeling before they had a fall, or things like that, because I don't know if doctors, well, I can't speak for all doctors, but I don't know if they actually ask people those questions. That they always say, have you had any falls? But I don't know if they work it back to,
exactly,
without just looking at the medication, whether they work it back to what you're doing, or what you were doing, or when you were eating and things like that. So I've just been trying to say to our support group that it's important to write down the timing of things and what you were feeling, or things like that, especially with falls.
Exactly. And it's really helpful, and even for yourself, you will probably, if you look back over what you've written, those dot point notes, whatever's happening, so you've got a bit of a record, because it's hard to remember back every day. So if you write those notes, you can look back over that. You can start looking at that yourself. Oh, okay, I've had the falls after, it happens, blah, blah, whatever you're finding. You can look for patterns. But if you've got that, it will alert the doctor as well. He mightn't be thinking of it just at that time. But if you've got that record, he can look at that. You can say, do you think there's a pattern there of blah, blah, whatever. If you look at that, then you can make maybe some changes yourselves, that not to the medication, I don't mean, but to how you're living your life and what you're doing in the water, the number of meals a day, all those sorts of things are an adjunct to the medication. But you can look at that and hopefully make some changes, so that you're going to improve your quality of life and better manage the symptoms. Because if you do have it, no cure for it, but certainly there's things you can do to improve things and make yourself safer.
Any more questions or comments?
I have another one.
Go for it.
Sorry, it's Beatrice again. Can you go into a little bit more detail? I know it's a slightly indelicate subject, about the straining on bowels. You mentioned that, and I'm not quite sure I understand how that affects blood pressure.
There's a big the vagus nerve, and that goes right up into the the brain, but right down to the gut. So you can have a drop in blood pressure even for people without Parkinson's if they have issues with severe constipation, and when they do have all that straining and effort, and they can have a drop in blood pressure causing fainting. So the vagus nerves involved with the Parkinson's as well. So not good for anyone to have that lot of straining and so forth with constipation. You need to have, and keeping up the fluids will assist with that, managing constipation. You don't absorb your medication as well. Parkinson's people don't absorb their medication as well if they don't have that constipation under control. The meds need to get from the stomach to the top of the small intestine to be best absorbed. And so you need to be constantly making sure that constipation is under control. You won't absorb the medications as well. And, a lot of that water is taken out of the waste products, and then you get that constipation. And then if there's straining, sitting over the toilet for long periods, which is not good for Parkinson's people either, can cause that drop in blood pressure.
Thank you.
That's it.